Hello and welcome to the Existentialist YouTube video channel. I am Donald Harvey Marks, a physician and scientist, a believer in reason, ethics, and healthcare access. My Existentialist podcast series is available on Spotify, Apple Podcast, and many other sources. My YouTube vlog channel, which you're listening to now, is at DHM49. I invite you to visit my personal blog, www.dhmarks.blogspot.com, where you can find all of my writings, a list of books I am reading and have recently read and liked, a list of other blogs which I follow, and much more. Today I'm going to speak about a very controversial subject. It's controversial particularly since many of my colleagues are totally against what I'm going to propose now. But I'm going to talk about whether all medical doctors should be required to accept Medicare and Medicaid patients as a condition of granting a state licensure to practice medicine. The summary of my thoughts are as follows. Medicare and Medicaid are two government programs to provide health coverage to millions of Americans. Yet, in the USA, having insurance coverage is not the same as having access to care. One major reason is that not all doctors accept Medicare and Medicaid patients. In 2018, 90% of physicians accepted new Medicare patients, while only 72% accepted new Medicaid patients. I can personally attest to that because I'm a Medicaid patient, in addition to being an active practicing medicine. But I have been having difficulties finding orthopedic surgeons in Morristown, New Jersey area that accept Medicaid. So I'm both a patient and seeing it from the other side. The main reasons cited for this discrepancy are the low reimbursement rates and the high administrative burdens of dealing with these programs. I could definitely attest to that, having been involved with billing departments trying to bill for services, especially to Medicaid, but also to Medicare. We as medical professionals, and now I'm addressing my colleagues, can reduce this coverage gap created by our fellow providers who opt out by insisting that all medical licensure boards tie their granting of a medical license to the acceptance of all insured patients, including those with Medicare and Medicaid. Medicare and Medicaid are two government programs that provide health coverage to millions of Americans. Medicare covers 67 million citizens aged 65 and over, as well as 8 million younger adults with certain chronic conditions or disabilities. Medicaid is a joint federal-state program that provides health insurance to low-income individuals and families. To date, 41 states, including D.C., have adopted the Medicaid expansion, and as of June 2023, approximately 94 million persons are covered by Medicaid and Children's Health Insurance Program, CHIP. Having Medicare or any insurance coverage is not the same thing as having access to care, because not all doctors accept all insurance, and particularly many doctors don't accept Medicare and Medicaid patients. So there is a situation. Patients have Medicare or Medicaid, or in some cases both, or as in my case, trying to find a local orthopedic surgeon that would see me for a problem. I am both a practicing physician and a patient with Medicare supplemental, so I have Medicare and supplemental insurance, so I'm fully insured, but not every orthopedic surgery group, to my surprise, would accept me as a new patient. Are you shocked, surprised, or offended? According to a survey by the AMA, in 2018, 90% of physicians accepted new Medicare patients, while only 72% accepted new Medicaid patients. The main reasons cited for this discrepancy are the low reimbursement rates and the high administrative burdens of dealing with these programs. I have faced this very frustrating situation in my own medical practice, and in my own personal life, as I just alluded to. Some healthcare equity advocates argue that all medical doctors should be required to accept Medicare and Medicaid as their condition of their medical license. They claim that this would ensure access to quality health care for all Americans, regardless of their income or age. They point out that medical doctors have a social responsibility to preserve the public good, and that accepting government insurance is part of their professional liability and responsibility and duty. Some opponents contend that medical doctors should have the freedom to choose their patients and their payment methods. They assert that forcing medical doctors to accept Medicare or Medicaid would violate their autonomy and their property rights. They also warn that such a mandate could reduce the supply and quality of doctors, as some would retire early, relocate to other states, or opt out of the system altogether. All physicians in the United States receive some form of public funding during their training. This funding can come from a variety of sources, including federal funding. The federal government provides funding for medical schools, residency programs, and other healthcare training programs through a variety of programs such as the National Institute of Health and the Health Resources and Services Administration. Another form of federal funding, which I personally benefit from, is military sponsorship. Number 2 is state funding. Many state governments also provide funding for medical schools and residency programs. And local funding. Number 3, some local governments also provide funding for healthcare training programs. In addition to government funding, many physicians also receive financial assistance from private sources such as scholarships and loans. However, even these private sources of funding often rely on government support in some way. For example, many student loans are guaranteed by the federal government. Because all physicians receive some form of public funding during their training, many healthcare equity advocates argue that medical doctors have an obligation to accept Medicare and Medicaid patients. I would also add to accept Medicare supplemental patients. There are a number of reasons why physicians should accept Medicaid patients. First, it is a way to repay the public for the investment that was made in their training. Second, it helps to ensure that everyone has access to quality health care, regardless of their income. Third, doing so can help reduce the burden on the uninsured healthcare system. There are a number of challenges that physicians face when accepting Medicaid patients. One challenge is that Medicaid reimbursement rates are often, but not always, and I pointed out particularly in the case of Medicaid OBGYN reimbursement. Medicaid reimbursement rates are often lower than that of private insurance companies. This can make it difficult for physicians to cover the cost of providing care to Medicare Medicaid patients. Another challenge is that Medicaid patients often have more complex medical needs. This can make it more time-consuming and difficult to provide care to Medicare and Medicaid patients. While it's important to encourage healthcare providers to participate in government healthcare programs like Medicare and Medicaid, denying medical doctors a medical license solely for not accepting these programs may not be the most effective or ethical approach. Instead, it may be more effective to incentivize their participation in other ways, such as matching Medicare and Medicaid to Blue Cross Blue Shield or Kaiser rates. Here's why. Number 1, ethical considerations. Denying medical doctors a medical license based solely on their participation in specific insurance programs could be seen as discriminatory and heavy-handed. All licensed medical professionals should be equally trained and treated equally, but their primary commitment should be to provide quality health care to patients, regardless of their insurance status. Number 2, access to care. Restricting access to care by revoking licenses may be counterproductive by exacerbating the shortage of healthcare providers, especially in underserved areas. A better approach may be to encourage more doctors to accept Medicare and Medicaid patients by offering realistic reimbursement rates, which also represent the cost of providing care and lowering administrative burdens. Number 3, focus on quality of care. Licensing should primarily ensure that medical doctors are qualified and capable of providing high-quality care. Accepting or not accepting specific insurance should not be the sole determinant of a physician's qualifications. Number 4, individual choice. Doctors often have valid reasons for not participating in government insurance programs, such as administrative burdens or low reimbursement rates. Some hold that it is essential to respect their professional judgment and provide incentives for participation rather than punitive measures. Number 5, incentivize participation. Instead of punitive measures, it may be better to create incentives for medical doctors to participate in Medicare and Medicaid. This could include improved reimbursement rates, reduced administrative burdens, or offering tax incentives for providers who accept a certain percentage of patients from these programs. And number 6, patient choice. Patients should have the freedom to choose their doctors. Forcing doctors to accept specific insurance could limit patient choice and interfere with the doctor-patient relationship, which is crucial for effective healthcare. Of course, it's crucial to encourage medical doctors to participate in Medicare and Medicaid without resorting to revoking medical licenses. Although the alternative of denying access to health care to the sick is, to me, even more onerous. In my opinion, by addressing the issues that deter doctors from participating and providing incentives, we may perhaps ensure that more healthcare providers accept patients from these programs while upholding ethical standards and individual choice. From a health equity and ethics standpoint, are medical doctors who refuse to accept Medicaid or Medicare simply greedy? Health equity is the principle that everyone should have a fair and just opportunity to attain their highest level of health, regardless of their income, race, ethnicity, gender, disability, or other factors that may affect their access to health care. By electing not to accept Medicaid or Medicare patients, even though these programs provide essential life-supporting health insurance for millions of low-income, elderly, and disabled Americans, those non-participating medical doctors are actively and intentionally denying patients the right to health and contribute to the health disparities that result from their unequal access to quality health care. One might argue that doctors who refuse to accept Medicaid or Medicare are greedy because they prioritize their own financial interests over the health needs of their patients. According to a report by Medicaid and CHIP Payment and Access Commission, the average Medicaid payment for 18 selected conditions was actually 6% higher than Medicare in the year study, which was 2012. Moreover, the average Medicaid payment for all but 2 conditions was higher than Medicare. This meant that doctors who reject Medicaid patients are not only discriminating against poor and needy patients, but also losing out on potential income. Another reason why doctors who refuse to accept Medicare or Medicaid might be considered greedy is that they are ignoring the social determinants of health that affect their patients' well-being. Social determinants of health are the conditions in which people live, learn, work, and play, and worship that influence their health risks and outcomes. These include discrimination, racism, poverty, education, employment, housing, transportation, economic status, and environment. By turning their backs on Medicaid or Medicare patients in favor of better paying patients, those doctors are failing to address the root causes of poor health and perpetuating the cycle of disadvantage and disease. Therefore, from a health equity standpoint, doctors who refuse to accept Medicaid or Medicare should be considered or could be considered greedy because they violate the principles of fairness and justice in healthcare. They also miss the opportunity to improve the health outcome of patients and reduce the burden of preventable diseases on society. The American College of Physicians The Internal Medicine Professional Society, to which I belong as a fellow, has a vision for improving healthcare access in America. ACP provides a comprehensive, interconnected set of policies for a better U.S. healthcare system for all. The first of ACP's comprehensive recommendations is that the United States should transition to universal coverage, which includes essential benefits, which I and most U.S. citizens and healthcare providers agree. Prior U.S. presidents, including FDR, Nixon, and Clinton, have also agreed and tried to implement this change. ACP vision challenges the U.S. not to settle for the status quo, but to implement systemic healthcare reforms. An additional set of ACP policy papers, published in the Annals of Internal Medicine, addresses issues related to coverage and cost of care, healthcare payment and delivery systems, barriers to care, and social determinants of health, and more. Although essentially a commendable set of proposals, I look forward to American College of Physicians giving more attention to the essentially uninsured, meaning those with unaffordable premiums, high deductibles, and poor access to providers. Not being able to afford health care is equivalent to not having access to health care. For many, it's essentially not available. In addition, if I should mention, as a corollary, that if a drug is priced in such a way that results in it being essentially unaffordable to most people, it is essentially not available to those in need, and in that sense, it has no efficacy. Drugs found to have no efficacy should have their approval from the FDA revoked by the FDA's own rules. The issue of whether medical doctors should be required to participate in Medicare and Medicaid is a complex and controversial one. It involves ethical, economic, and legal considerations that affect both doctors and patients. I look forward to your comments and feedback on all these issues. Thank you for listening.